Hello, this is Dr. Gibson, and I wanted to spend some time talking to you about the Cultural Awareness in Nursing course. Well, it's a wonderful course, and it's designed to help students to become more culturally aware of themselves as well as other sociocultural groups. The course is an online course, as are all the electives for the RN to BSM program, and it involves different activities. It is considered to be an immersion course, so part of the course is involved with completing assignments weekly. Part of the course involves reflective journaling, just a few reflective journals, and then there are some wonderful opportunities to engage with other sociocultural groups and with family members. So the reflective journals are one of them in particular relates to the Hmong culture. We think of Vietnam when we think of the Hmong. So the students read a book, The Spirit Catches Me and I Fall Down, and it's a wonderful book that compares Western medicine or healthcare with Eastern beliefs, sociocultural beliefs. And so the students read that book, and by the end of the course, were able to really identify with the persons who were the patients and family members in the book and talk about their journey toward cultural competence. Other activities involve a journal that's kept with the students who interview both their family members as well as persons from other sociocultural groups. So there's a heritage assessment tool where the students answer questions from the textbook, and there is a list of questions and they answer them from a particular cultural group. They compare the answers from the sociocultural group to their own perspectives and write a short discussion about that. So that is done, and the students have commented that they learned a lot about themselves, and they were able to compare beliefs, for example, of child rearing practices as well as end-of-life care or end-of-life issues. The other big part of the course is a hiking expedition. So the students actually become immersed in a culture. So last year, when the students took the course, several students went into different Hispanic cultures. One student in particular did an excellent job, and this is an oral presentation as well as visual. So this student videotaped herself and the community from an East Indian sociocultural group. So she went in Colombia, was toured by a friend of hers who's a nurse. They went to the place of worship. They went to the market where they smelled and saw the colors of the herbs and spices. They were very vivid and beautiful. She tasted the foods from the culture and really got immersed and did a wonderful presentation. It was visually appealing, and she did an excellent job narrating it. Another student went to Cherokee and learned about the Cherokee Nation, and he did an excellent presentation. So that's really the immersive part of the course. Another area in the course where students really learned about themselves and their family backgrounds was the ethno-health family interview. And here the student went and interviewed a maternal side person in their family, a mother, an aunt, a grandmother, and asked them specific questions about their beliefs, health beliefs, illness beliefs, health practices, etc. And then they compared what they said with what their beliefs were. So those are examples of the activities that students were engaged in the course. Comments from the students were very positive. Students told me that everyone should take this course because nurses are required to care for persons from all sociocultural backgrounds. The United States is no longer considered a melting pot, but tossed salad. So with tossed salad, there are vividly colored salad items: lettuce, tomatoes, carrots, green peppers. You can tell I like salad. But you have lots of colors and tastes, and all those blend together to create something that is beautiful, like a tapestry. So that's really the way we think of culture now, and the care of persons from sociocultural groups. In order to provide safe, effective care to persons from different sociocultural groups, we need to become culturally competent, more culturally aware, culturally humble, so that we can be the best caregivers possible. The course Cultural Awareness in Nursing helps students to do that. I hope many of you will decide to take the course. If so, I look forward to interacting with you. Thank you. Bye.